I met a cardiologist practice that, and I tell other speeches, but you may not have heard this, that was showing zero entries for blood pressure measurements in all of their outbound EHR data. Cardiology practice. So if you think about it, that is the last practice on the planet you'd expect to not have blood pressure.
Right.
And so what they had done with their EHR is they're very advanced. What they did was they got the instructions on how to customize the EHR because they like to measure left blood pressure and right blood pressure. You go to a cardiologist, which I have gone to, it's raise your right hand, for a couple 30 seconds. Now put your arm down, measure, wait 2 minutes, raise your left hand for 30 seconds, or put your arm down, measure that. And they'll do this multiple times, at least the first time they see you, because there is a difference in the right side and the left side in terms of blood pressure measurements. So they made their own fields. No one told them to map at least one of them or figure out some averaging technique with a new field to put it back in the place that everybody else expects it to be. So one day, like they're doing meaningful use, this is back in meaningful use days, and their scorecard, when they were trying to get their check as a Medicare practice, was showing 0/0 for blood pressure measurements. And that's impossible, that they have never tried to do a blood pressure. And they're like, oh my God, what do we do? Now, it wasn't a difficult fix. It was, they went to the vendor, said, we did this thing. Oh, what you just got to do is now map it back there so that we don't lose this. All is good with the world. But you don't know often until it's observed.